The measles outbreak has made its way to Nebraska. A child in the Panhandle has tested positive for the disease. The health department is only sharing that the child has not been out of state recently and is age appropriately vaccinated, which could be one or both doses depending on that child's age, which is not being released. There is no word on how they contracted the disease. As for now, health officials are stressing that it is important to remain calm. Measles is one of the most dangerous diseases for young children and infants, and it is the most infectious disease known to man. A huge misconception is that measles is just a bad case of chickenpox, which isn't true. This infection can lead to some serious side effects and even death.
We know that about 1 out of every 5 people who get measles will be hospitalized. 1 out of every 20 children with measles will get pneumonia, which is the most common cause of death from measles in young children. 1 out of every 1,000 people with measles will develop brain swelling, which can lead to brain damage. And about 1 out of every 1,000 people with measles, up to 3 out of every 1,000 people with measles could die from the complications.
Chief Medical Officer for the Nebraska Department of Health and Human Services says that because the patient has not been out of state, they are not likely to be the only person with measles in Nebraska.
We're very, very early in this investigation, so we really don't have a definitive answer on that yet. We don't really even have any definitive numbers of people that may have been exposed. We are working very closely, as I said, with the local health department and the regional hospitals to begin that contact tracing, contact investigation.
Dr. Tessmer added that the best cure for measles is prevention, which in this case is vaccination for the disease. He showed that the vaccine is 97% effective for minimizing impacts from the measles, though just because you have a vaccine doesn't mean that you're immune from it. It just means that you are less likely to be infected or suffer serious side effects. Right now, the DHHS is saying that if you were present at Family Dollar in Rushville on May 17th from 9 until noon, or Gordon Memorial Hospital Clinic in Gordon on May 21st from 8 a.m. to 1 p.m., then you may have been exposed and should fill out the risk assessment survey. You can find that linked on our app.